Hi everybody, today our new video, anatomy video concerning the muscular system will begin. And first we're going to look at the muscles on the human model, and then we're going to look at all these independent muscles in the cadaver after that. So today the topic will be the superficial back muscles, the shoulder muscles, and both the anterior aspect of the arm and the posterior aspect of the arm muscles. Okay, so this is the human model, and what we're going to look at is first the superficial, one of the important, and it is trapezoid shaped muscle, and we call this muscle trapezius. All right, so we have this muscle here is trapezius. It has wide range of attachment to the origin point. It attaches, and again, it has a wide range of insertion points too. And if you look at the, so we have three heads: the upper head, the middle head, and the lower head, or superior, middle, and inferior head of the trapezius, as you can see, and it has it has multiple direction, the muscle fibers. So the superior head goes this way, right? And the middle head goes this way. It has a horizontal. So the upper head has a vertical, downward direction muscle fibers. The middle head has a transverse, horizontal directed muscle fibers, and the lower head, as you can see, has an upward directed muscle fibers. So basically, all these have different functions. So you have for instance, the origin would be the external occipital protuberance, the superior nuclei, the ligament, nuchal ligament, and then we have the spinous process of the thoracic vertebra, all the way down here. And insertion point would be primarily on the anterior side, lateral 1/3 of the clavicle, acromion, and the spinous process of the scapula. So basically, what happens is superior fibers would pull the clavicle and the scapula. So basically, it would slightly elevate or move the upper shoulder towards the body, or elevate the shoulder a little bit like this, like so. All right. And the middle fibers, as you can see, when they contract, they would retract the scapula backwards. Okay. When they pull the spinous process towards its origin point, it would retract the scapula backwards. The motion would be like this. All right. So then lower fibers or lower head would pull the spinous process, okay, downwards towards the origin, and it would basically depress and slightly depress and slightly retract or move towards the vertebral column. So it would depress primarily and slightly move back the scapula backwards to the vertebral column. So that's basically the function of the trapezius, okay? And one of the important cranial nerves innervate this muscle would be the accessory nerve, 12th cranial nerve, is trapezius. Okay, the next muscle that we have here in the superficial part, the external layer of the back, would be the latissimus dorsi or latissimus dorsi muscle, which is this back muscle here. Okay, it gets its origin from the lower thoracic, lumbar, and thoracolumbar fascia and iliac crest of the ilium, and then goes, and these basically, the muscle fibers move towards one direction. Okay, however, in the trapezius, as you can see, the muscle fibers have multiple directions. However, the latissimus dorsi muscle fibers, they move all along towards the insertion point, which would be the floor of the intertubercular sulcus or bicipital groove, all right, at the front. So it goes under the shoulder and the axilla, goes to the front to the intertubercular sulcus, all right, and attaches there. So basically, what happens is it medially rotates, it pulls the head of the humerus backwards, so it extends, it medial rotates, okay, and slightly adducts the arm towards the body. Okay, so the latissimus dorsi, so basically, so this attaches to the intertubercular sulcus. Basically, it pulls back the shoulder. All right. So this is extension of the shoulder of the arm. slightly medially rotates. It medially rotates the arm, and then slightly adducts, moves the arm towards the body, and that's the function. And the nerve is the thoracodorsal nerve, one of the important nerves again that innervates that's the dorsal muscle, and this is the swimmer's muscle, basically. Okay, so these are two muscles. Just beneath these two muscles, what we have here is, okay, so this on this side, trapezius is removed, and that's this dorsal muscle is also removed. So at the top, if you look at, right, so when you remove the trapezius muscle, what we see here is these muscles. One, we see this muscle here. This is levator scapular muscle. I don't know if you can see it, but this is a levator scapular muscle, and it has the origin from the spinous process of the lateral transverse process of the cervical vertebra, and attaches to, as you can see, the superior angle of the scapula here. And basically, when it contracts, it pulls, the origin pulls the insertion point. So basically what happens, it elevates the scapula. As its name implies, it's a levator scapular muscle, so it elevates the scapula and moves the scapula slightly upwards. So it elevates, okay? It elevates the scapula. What else do we have here? Then we have the rhomboids, okay? Rhomboids. Rhomboid minor, rhomboid major, as you can see. And these rhomboid muscles, again, pull, okay, so they originate from the spinous process of the lower, from the upper thoracic spinous process, and all the way down to the lower, excuse me, to the spinous process of the thoracic region. And it inserts to the medial border of the scapula, as you can see. So teres minor inserts to the this triangular root or area of the scapula, while the majority of the medial border of the scapula will be insertion of the teres, so rhomboid major. So this is the rhomboid minor, this is the rhomboid major, and basically the nerve for these muscles would be dorsal scapular nerve, one of the important nerves that comes out from the brachial plexus. And so the function of these muscles, when they pull, again they retract, slightly elevates and slightly retracts the scapula backwards. Okay, so this motion here slightly elevates and retracts the scapula backwards. Rhomboid minor, rhomboid major. Okay, what else do we see here? We see two important muscles here with supraspinatus muscle, and then we see the infraspinatus muscle here. Okay, and supraspinatus muscle is located in supraspinous fossa. Infraspinatus muscle is located in infraspinous fossa, all right? And these two muscles are innervated by the suprascapular nerve, right? Okay, and basically, and then next to it, you have the teres minor muscle. So we have supraspinous, infraspinous, teres minor. Just beneath that, we have the teres major muscle, right? So supraspinatus, infraspinous is innervated by the suprascapular nerve. Teres minor here is innervated by the axillary nerve. Teres major is innervated by the lower subscapular nerve. All right. So these basically supraspinous, infraspinous, teres minor, along with the subscapular muscle, these are also referred to as rotator cuff muscle. Sits muscle, SITS, would be supraspinatus, infraspinatus, teres minor, and subscapular. So basically these all are insert to the greater tubercle of the humerus. However, the subscapularis muscle inserts to the lesser tubercle of the humerus. Basically, all these muscles are strengthening, and they cover the shoulder joint, and basically they have this protection type of function. It's one of the important functions of the supraspinous, along with its protection of the shoulder joint. It would be the initial abduction of the shoulder, which is really important. First, to 15 degrees, abduction is primarily accomplished by supraspinatus muscle, which is important. So 0-15 supraspinatus, 15 to 90 is deltoid, 90 to above would be serratus anterior. And this is the abduction of the arm, which is involving three important muscles. Okay, so this is a deltoid muscle. So this is the shoulder point, and let's look at the anterior aspect now. So what we see here would be, first would be the pec major muscle. This is pectoralis major. As you can see, it originates from the medial third of the clavicle, goes all the way down and inserts on the lateral border of the sternum and parts of the ribs here, and then goes and attaches to the humerus, or the intertubercular sulcus there. And basically what happens, it pulls the insertion point towards the origin, so basically it flexes, right? It flexes, medial rotates, and adducts the arm. So it has the function, it has important functions to the shoulder and the arm. Just beneath the pectoralis major muscle, we have the pec minor, which is this. It originates, as you can see, 3, 4, 5 ribs, third, fourth, and fifth rib. Sometimes 1, 2, 3, 4. So the here it originates from the second, third, fourth, and fifth, but usually it's 3, 4, 5, 3, 4, and 5, fifth rib, and then inserts, as you can see, to the coracoid process of the scapula. Basically, it stabilizes the scapula and then retracts. When it pulls the coracoid process of the scapula, basically retracts. It pulls the scapula forward. All right. It pulls the scapula forward. So this is the pec major, pec minor. Pec major is innervated by the medial lateral pectoral nerve. However, pec minor is innervated by the medial pectoral nerve. What else do we see here? The other muscle that on the anterior side, what we see is subscapularis muscle. Again, subscapularis muscle is located in the subscapular fossa and inserts to the lesser tubercle. This is one of the rotator cuff muscles, SITS muscles, okay? And it's innervated by the upper and lower subscapular nerve. All right, what else do we see here? We see the deltoid, okay? On this side, this is deltoid here. It has a wide range of origin point, which starts with the clavicle here, the acromion, and at the back we have the spinous process, and then they all come together, they fuse, and they attach to the deltoid tuberosity, the humerus, on the lateral surface, on the anterolateral surface of the humerus. Okay, so this is deltoid. Basically, deltoid, you have the anterior fibers, middle fibers, and posterior fibers. When they act independently, basically the anterior fibers would flex, the middle fibers would abduct, and the posterior fibers would extend the shoulder. All right. And one of the important function of this is abduction. Is between 15 to 90 degrees. Abduction is accomplished by the deltoid muscle. And nerve for the deltoid muscle is the axillary nerve. Don't forget that. Okay, what else do we see here? Let me look at. Then we can look at the serratus anterior muscle, which is this muscle here. Okay, it's serratus. It's tooth-like, and it originates from the ribs from 1 to 7, and then goes backwards and inserts, as you can see, inserts in the medial border of the scapula, and basically when it pulls the insertion point, or when the origin pulls the insertion point towards itself, you have the pushing motion. Okay, it pulls it, so basically you push. Okay, and motion or movement. And this is also referred to as boxer's muscle. So when you do this motion here, move the shoulder forward or scapula forward, it is done by the serratus anterior muscle, and this is innervated by the long thoracic nerve, right? So don't get mixed up. Let's just start side thoracodorsal nerve, serratus anterior long thoracic nerve. Don't forget that. All right, and then what else do we have here? Okay, that's it. So let's look at the arm. And then we have on the flexor side of the arm, on the anterior or ventral aspect of the arm, we have 3 important muscles: the flexors, the biceps, coracobrachialis and brachialis muscle. We're going to look at these independently. Okay, as you can see, this is the flexor side of the arm, as you can see. So we have the biceps. So we have biceps, it has 2 heads. Okay, biceps, 2 heads. You have the long head and the short head. So this is the long head, this is the short head. Short head attaches to the coracoid process. However, the long head goes through the articular capsule, in the joint capsule, through the bicipital groove, and attaches to the supraglenoid tubercle of the scapula. and it doesn't basically, so it traverses the shoulder joint. It goes all the way, they come together, they get all the way down and attach to the radial tuberosity on the radius. So it doesn't have any attachment point on the humerus, the biceps muscle, okay, don't forget that. So it basically attaches to the coracoid process, which is part of scapula, and the long head attaches to the supraglenoid tubercle, and it is also part of scapula. And in the insertion point, it attaches to the radial tuberosity, which is part of the radius. So it doesn't have any attachment point on the humerus in the arm. So this is biceps. This is coracobrachialis. This is okay, and it goes to the coracoid process and it attaches to the humerus. So coracobrachialis does have attachment on the humerus, and then the brachialis, again, origin point from the anterior aspect of the humerus, and it attaches to the ulnar tuberosity. All right. So all these three muscles basically is important in flexion of the forearm. So they go attach it here. They flex, and one of the important flexors of the forearm is the flexors of the arm, which is that biceps, brachii, coracobrachialis, and brachialis muscle. And the other important function is supination. Okay, when you screw a driver, okay, when you use a screwdriver, you do this motion, you do supination motion. So this motion is primarily done by the biceps muscle. So biceps, one of the important functions of the biceps is flexion of the forearm and supination of the forearm. All right. And the nerve of these muscles is musculocutaneous nerve. And then we have the triceps muscle. It has three heads: triceps, long head, short head, and lateral head. I'm sorry, long head, medial head, and lateral head, which is located on the posterior aspect of the arm. And this is basically attaches to the olecranon of the ulnar. Basically, it extends the forearm. It pulls the olecranon process backwards and extends the forearm. Okay, so the attachment points are a little bit different. The medial lateral head attaches to the posterior aspect of the humerus. However, the long head attaches to the infraglenoid tubercle of the scapula. All right, and they all come together. They form a tendon, and they attach to the olecranon process of the ulna, and hence extension of the forearm. And the innervation of these muscles would be the radial nerve. Okay, that's about it. So we're going to look at these now on the cadaver and try to see and pinpoint the important muscles in this particular area. Let's go and start. Okay, hi everybody. So this is the cadaver. This is a male cadaver, and first what we did was doing a dissection, or skin dissection first, of course. So we got the skin out, and we did a flap. Okay, so this is the subcutaneous fat and deep fascia. So we got all these out of the way. Okay, we got the skin, and what we see here is the back of a person. All right, and these are what we see here is the superficial back muscles, and there's an intermediate muscles in the back, and then there's also deep what we call as erector spine, deep back muscles. We're going to look at that later on. So today, the topic of our subject today would be the superficial back muscles. Okay, so the first muscles that we see here is okay. Let's look at this muscle here. This is latissimus dorsi muscle, as you can see. So, and this is the insertion point, and all these fibers come together, and they go under the axillary region and go in the front to insert onto the intertubercular sulcus, the floor of the intertubercular sulcus. So this is the latissimus dorsi muscle here, innervated by thoracodorsal nerve, and it has a wide range of attachment to the lower lumbar, the thoracolumbar fascia, and iliac crest. So when we detach the origin point, let me just flip this muscle out of the way. Okay, so what we see here is, okay, so no, I'll flip that a little bit later. So in the next muscle, it would be the trapezius. This muscle here is trapezius, And the other side is not dissected here, but basically when you look at the trapezius on both sides, it looks like a trapezoid type of structure. So this is trapezium. So you have the upper head, the middle head, and the lower head. So we have the fibers going towards the origin points, the insertion point. The origin, it comes from the external occipital protuberance, the superior nuchal line, and then the spinous process of the thoracic vertebra. All these are insertion. And as you can see, the lower head fibers going upwards, the lateral head going in this direction horizontally, and the upper head would go down, and basically they attach to the spinous process and the outer part of the clavicle, the lateral 1/3 of the clavicle. So this is trapezius muscle. Okay, I'm going to flap this and take this out of the way. So what we see here, just beneath the okay, I'm going to get the Lexipstorsi out of the way too. So when these are removed, what we see here is the muscles which are closely associated with the scapula. All right. So okay. So these are the muscles just beneath the trapezius. Okay. So this is trapezius. When I get this out of the way, we see three important muscles here. Okay. The first muscle is the levator scapulae muscle. Okay, so this muscle here is levator scapulae, all right? And basically this is the scapula here, and so here this is the insertion point, which is the upper angle of the scapula. And this muscle here is the rhomboid minor, and this muscle here is rhomboid major. Okay. So rhomboid major, rhomboid minor, levator scapula. All these are innervated by dorsoscapular nerve. Rhomboid minor and major, as you can see, its attachment point is the lateral border, the medial border of the scapula. Yes. So this is the medial border of the scapula, all right, and this is the lateral border of the scapula. Here is the superior border of the scapula. So basically, all these three muscles, the rhomboid major, rhomboid minor, levator scapula, inserts on the medial border of the scapula. All right. So these muscles, where are they located? They're located beneath the trapezius. Okay, don't forget that. And the other muscles associated with the scapula would be this muscle here. Okay, by the way, this is the spinous process of the scapula. Above that here, there's a muscle. This muscle here is a supraspinatus muscle. Supraspinatus muscle. Remember, there was a fossa, supraspinous fossa of the scapula at the back, dorsal aspect of the scapula, and this supraspinous fossa is occupied by the same named muscle, which is the supraspinatus muscle. This is the infraspinatus fossa, and it's occupied by the infraspinatus muscle. So supraspinatus muscle, infraspinatus muscle. All right, and from the lateral border of the scapula, which is this area. So this is the lateral border of the scapula, this is the medial border of the scapula, and this is the superior border of the scapula, and here is the spinous process of the scapula. Okay, just to get you oriented. Okay, I basically gave you a pinpoint landmarking. So on the lateral border of the scapula, we have two important muscles, which is the teres muscle, which is the teres minor and teres major. This muscle here is teres minor, and this muscle here is teres major. All right. So this is teres minor, and this is teres major. So as you can see, teres minor attaches to the it goes all the way to the humerus and attaches to the just like the infraspinatus and supraspinatus, it attaches to the great tubercle, all right, of the scapula. And then we have teres major, and goes below the axilla, and again attaches to the tubercle of the humerus. Okay, so let's look at it again. Supraspinatus muscle, infraspinatus muscle. This is the teres major, and this is the teres minor muscle. All right. What else do we see here? We see the deltoid. Okay, so this muscle here, the pyramidal shaped muscle, triangular pyramidal shaped muscle, is a deltoid muscle. All right. And so if I flip deltoid a little bit in this direction, Now, what we see here in the posterior aspect of the arm, let's look at this region here. So this is the arm region, all right? So this is the posterior aspect. One of the just one muscle here on the posterior aspect would be the triceps brachii muscle. Triceps brachii muscle has 3 heads. It has a long head, which is this. This is the long head. This is the lateral head. Okay, this is the long head of triceps, lateral head of triceps, and medial head is below. So this area here, this is the medial head. It's attaches on the medial side of the humerus. So long head of the triceps, lateral head of the triceps, and below that is the medial head of triceps. So basically, all these muscles are triceps brachii muscle, right? And what we see here, so this is triceps. What else do we see? All right. Now, after looking at these areas, there is the intermuscular spaces in this area. There's, as you know, there's 3 important spaces here. We have a quadrangular space, we have the upper triangular and lower triangular spaces or areas. So let's look at them one by one. So let's look at the quadrangular space first. Quadrangular space, which is this area here. And quadrangular space is basically formed by the borders formed by the long head. As you can see, this is the long head of the triceps, all right? And this is the lateral head of the triceps. Okay, and then we have the upper border would be formed by this muscle here, would be the teres minor, and the lower border would be the teres major. So this is the teres major, all right? So this is the teres major. This is teres minor. This muscle here is long head of triceps, and this muscle here is the lateral head of the triceps. All right, so basically we have quadrangular shaped area, as you can see. 1, 2, and then we have teres major muscle here. This is a tendon of teres major muscle, and then this is the lateral head. So we have this quadrangular shaped structure. All right. So what passes through quadrangular structure? Remember, would be the axillary nerve and posterior humerus circumflex artery, which are these guys here. So one of them here is the axillary nerve, all right, and the other here would be the posterior humerus circumflex artery. So one of this is, I think, okay, this is the artery, posterior humerus circumflex artery, and this guy here would be the axillary nerve. And again, as you can see, the axillary nerve goes in this direction and innervates the deltoid muscle. And it also innervates the teres minor muscle. So the axillary nerve innervates teres minor and deltoid muscle. So we have the axillary nerve, and then we have the profunda brachii artery, which is a content of the quadrangular space. Okay, what else do we have here? With the lower triangular space, which be in lower triangular space, right? This lowest triangular space would the boundaries would be the long head, lateral head, and teres major. So basically, this is teres major. You can see the tendon, this white sheath. This is the tendon of teres major. So it goes like this in the upper border. And then, right, and then we have the long head. Okay, the medial head would be the shaft of the humerus. Okay, again, the medial head in the quadrangular space is also important. That's the surgical neck of the humerus. Okay, and so the lower triangular space would be the upper border would be teres major, which is this, and then we have the long head of triceps, and then we have the shaft of the humerus. So what passes through the lower triangular space would be these guys here. I don't know if you can see it. You see these? Okay, let me get this out. Okay, so what do we see here in the lower triangular area, which is these guys here, which be the the radial nerve and profunda brachii artery. So basically, one of them is radial nerve, and the other would be the profunda brachii artery. So these basically run together. They run parallel together, and we see them in this lower triangular space. And the radial nerve, as you can see, it innervates the triceps muscle. Okay, so it comes in the posterior compartment of the arm and innervates these innervates the triceps muscle. Okay, so this is the lower triangular space. In the upper triangular, which is this area here, in the upper triangle, what we see here, we see the teres minor, teres major, and the long head. Okay, so this area here would be the lower triangular space. And inside, we have the circumflex scapular artery. Okay, I think somewhere around here would be this guy here would be the circumflex scapular artery, passes through the upper triangular space. Okay, so with this triangular space here, so we have the upper triangular, the borders of this triangle would be teres minor, teres major, and the long head. Let's look at it again. The quadrangular space. Let's look at the quadrangular space. The borders would be teres minor, teres minor, teres major, teres minor, teres major, long head with triceps, and the surgical neck of the humerus. The lower triangular space would be this area here, would be the long head of the triceps on lateral border. We have the teres major, and on medial border we have the shaft of the humerus. Okay, so the contents of the quadrangular space would be would be the axillary nerve and posterior humerus circumflex artery. The contents of the lower triangular space would be the radial nerve and profundobrachii artery. All right, and the contents of the lower triangular space would be the subscapular artery. Subscapular artery, and it's a branch of the axillary artery. Okay, so I think that's about it. So we basically covered. Okay, so basically we covered a lot of things here. So we finished up the superficial back muscles. All right, we looked at them. Okay, one thing that I didn't show you. I just realized that. And then we have serratus anterior here. So this muscle here, as you can see, is serratus anterior. Okay, so this is partially anterior or ventral muscle, or the it's lateral located muscle. So this muscle here that attaches to the ribs on the lateral side of the rib cage, and it goes all the way and inserts to the medial border of the scapula. So this is the serratus anterior muscle. And by the way, here's the nerve. Okay, here's the nerve of the serratus anterior muscle, and which is this is the long thoracic nerve. Okay. And when this nerve is paralyzed, when the muscle is paralyzed, when there's a non-functional nerve, you would have a wing scapula, and we'll talk about that in the lectures. So we have this is long thoracic nerve, and this is serratus anterior muscle. Serratus anterior muscle on the lateral side. Okay. So I think we covered a lot of things, and so this is about it for today. So we covered the superficial back muscles, supraspinatus, infraspinatus, levator scapula, rhomboid minor, rhomboid major, latissimus dorsi, and then we have teres minor, teres major, deltoid muscle, triceps. We looked at the tricep. We looked at the triangular spaces, quadrangular, lower and upper triangular space, and the contents of the triangular space, and latissimus dorsi muscle, and serratus anterior muscle. Okay, thank you very much for listening. See you in our next anatomy video. Thank you, and bye-bye.